Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Welcome to the Doctalk show. I'm here with Dr. JAFHAR and Dr. Billy, our gynecologists, and myself, Dr. PHIONA. We are here to answer your questions that you've always had about antenatal care. Most expectant mothers, especially first-time mothers, find it difficult to cope and manage with a new experience and challenges that come with pregnancy. The good thing is that antenatal care is there to detect and manage these problems early enough for the good outcome of the baby and mother.
Yes, it's not surprising that most of the mothers assume that a pregnancy outcome and getting a very nice bouncing baby or a very healthy baby, it's an obvious thing. Yeah,
because usually antenatal, it is a very important aspect, but our mothers who have been there before, I'm having the second, third, fourth baby, they're a bit reluctant to attend antenatal because they've been there before, it's been successful.
I think they're a veteran.
Yeah, so I'm asking myself, I went through it last time, I know exactly what I did, do I have to?
No. What women forget is that each pregnancy is unique. Much as you've had 6, 7 babies, the 8th pregnancy could actually be problematic. People forget that with every pregnancy comes a new experience. So every pregnant woman needs to attend antenatal care.
Those ones carrying maybe the 4th, 5th, and 7th babies, the high risk, we term them high risk. The more you have more babies, the more the risks can come to you, more than these are first-time mothers.
Exactly. People come to hospitals, people go to clinics, and do they even know what antenatal is? You'll be seeing someone for the 3rd time and they're asking you, when doctor do I start my antenatal? You know, it's a word that is commonly used. I'm going for antenatal, but most times people...
Yeah. Maybe even as the doctors, you have not explained to these mothers to understand the importance of this antenatal care.
So if I'm pregnant, I've realized that I'm pregnant, I don't know what to do. Who should I call? Where should I go?
Because as the way you see antenatal is the time or the care we give to the pregnant woman from the time she conceives throughout her pregnancy until towards the time of childbirth.
As soon as a woman misses her period or realizes that she's pregnant, she should go for her antenatal care, the first antenatal care visit.
Our mothers, incidentally, of course, there are so many challenges that will come alongside that. Someone will tell you, my periods have been missing ever since I started. I've been skipping. Sometimes I go 2 months without my period. The other time I had a period that didn't look normal, so I can't know whether I'm pregnant.
The reason you're supposed to attend, because if you have had problems with your periods, and these are the mothers who need to come to antenatal or to come to seek medical care a bit early now.
And pregnancy itself is not about missing periods. There are so many other symptoms that come along besides missing your period.
That will tell you that you're pregnant.
Yeah, exactly. Will give you a high index of suspicion that you could be pregnant.
At this point, that's when people ask themselves, I had a normal pregnancy, I've had 3 normal pregnancies, but why exactly should I go for antenatal care? I think that's a question that most people ask themselves. Or I went for antenatal care last time, but God forbid, I still lost my baby.
And I know I was given ABCD, so can't I just go to the pharmacy and buy stuff?
Yeah, of course, at this point, people need to realize that antenatal is not folic acid. It's not given, because people think that, doctor, if you...
And not doing a scan.
Yes, come to my office, I do the examination, detect that there's no problem. That is good enough. But people think that if you give folic acid, or if I buy folic acid from the store, that is antenatal.
Not at all, not at all. And the World Health Organization, the Ministry of Health in Uganda has directed that we need to have, each woman should have a minimum of 4 antenatal care visits. Even when the pregnancy is normal and safe, those ones should have a minimum of 4. And we can actually have many more if we have a high-risk mother.
Any pregnancy should be supervised, and it should be supervised for reasons that any pregnancy can develop a complication along the way. So whoever is attending to you, whoever your care provider is, should be able to anticipate these problems or even pick them up if they arise. Sorry. So antenatal care is a very crucial part.
And the good thing is that all our health facilities in Uganda provide antenatal care services. So no woman should go out there and claim that I went somewhere and did not find antenatal care services. They are everywhere in this
Even the small clinics you can run the antenatal.
Yes. And even in the villages.
You don't need any machines to do antenatal care.
So you need, who do I need? A midwife? Do I need a doctor? Do I need a super specialist? Do I need a professor?
Anyone, a doctor would specialize to deal with women or with special treatment, special training to deal with women, or even...
so any doctor can take me through antenatal, yes. A midwife can take me through antenatal, a clinic officer can take me through antenatal.
Yes, a clinic officer will take you through antenatal care. And any health worker who has had experience of dealing with pregnant mothers will take a woman through antenatal care. A midwife who is trained can do the antenatal care and get the mother to the end. Only that sometimes we have those we call high-risk mothers that definitely need to be managed. Yeah,
but because every woman is at risk, we need to remember that 85% of pregnancies will be uneventful, without any problem. But there's a 15% which might get a problem. And perhaps when you do antenatal, you want to look out for these 15% actively, so that we reduce on the mothers who die,
exactly, or
even get complications during
childbirth. The burden in Uganda and most other African countries is still a big one. We lose so many mothers because of pregnancy and their related complications. Approximately 16 mothers die a day in Uganda. That is the current statistics, and that is quite a number. 16 mothers is...
You know, if
that's a taxi full
of passengers.
It would actually make news if
yes. If in Uganda we had a taxi crashing every single day and us losing those people every single day, it would be news all over the place. But when these mothers die, I wonder who talks about them every single day.
Maybe because the ones that we also produce every day are very many. Maybe it counteracts that. Our fertility rate is quite
because high. Uganda is a third. I think has a third.
We have the highest fertility rates almost in the world. So maybe
next to Benin,
because we always have people to get pregnant and
yeah, but every life matters. We should not lose a mother.
At this point, we need to know, like the past figure president who said that women, they're dying not because we don't know what is killing them, but because we are yet to decide whether their lives are worth saving. So it's us to decide that we need to save these mothers.
And that brings us to who makes that decision, because we know that in our cultures we have the husband, we have a mother-in-law, all those make the decision in the woman's life, whether she should even go for antenatal care or not go for antenatal care.
More reason to go for antenatal, because you're looking at most of these things that kill mothers, they are preventable. Look at excessive bleeding, look at high blood pressure during pregnancy.
Difficult labors, obstructed labors.
Exactly.
Abortions and these complications.
You're talking about the early pregnancies. So most of these things can be either prevented or managed appropriately if someone...
And with minimal resources. We don't need this.
But that is why we are involving men. We need high male involvement when it comes to antenatal care. The problem with us is that when a woman gets pregnant, it's a woman's problem. Yet it is a combined effort.
But I think these days, okay, men try, but I think these days also, the women know these days have more money than us, so they're the decision makers.
Whether to go for antenatal
they think that it's not necessary, they don't need to pass.
But looking at the other end of our society, you know that most people are relatively poor. You find they need to go to government settings, and if you've been there, or for most of us who've been there, the queues are so long, unbearable. Someone goes there in the morning, 6 a.m., and they will only see a midwife, a doctor.
Yes, if you're a working mother, basically it means you have to kill a day.
Looking at the other private hospitals, people will tell you they're expensive, I cannot afford, so maybe men are a little bit restricted in that way. So maybe having a plan, and a plan involving you, the mother, your husband, and is very crucial in determining where to go.
Right after this, Dr. JAFHAR and Dr. Billy have a lot to tell us about antenatal care, what you'll find when you go to the hospital.
You are watching the Doctalk Show.
A good school doesn't tolerate violence against children.
Because a good school equals a better life.
Raising voices.
You are watching the Doctalk Show.
So in this era of social media, where a patient contacts you on WhatsApp, on Facebook, so you receive all these texts and she expects you to actually do antenatal clinics on phone.
Dr. JAFHAR, Dr. Billy, someone gave me your contact. I think I'm 5 months pregnant, I'm 2 months pregnant. What can I take? What can I do? What can I take? These are the common questions.
Yes.
What medicine can I take? Do I need to come and see you?
We can't run it from social media.
Yes.
It's us to make it like a formal way of making appointments.
Of helping
these clients. If something we need to examine your patient, you have to make an appointment. Like, okay, please, can you come
And every
first?
patient needs to be examined. You can't be treated on phone.
If it were a one sentence, a one statement answer, you'd probably tell someone, advise them do this. But this is a very long journey that you're going to take someone through. So you need to sit down and tell them exactly.
You can miss some complications.
Exactly.
People are taking scans to be their
Oh, yes. I went for a scan, I did this. So I think...
someone is coming to see you 2 months.
The scans are taking our work.
Exactly.
And even as doctors, we are no longer doing any work. Abdominal pain, scan.
I want to know the sex scan.
Someone comes 2 months pregnant and they've done 4 scans already without...
But I think most important, that is why people need to know now what to expect when they come for antenatal care. How many scans they should do, what tests they should be expecting, because we have routine tests that we do and we have extra tests that we do for mothers who are high risk.
Sure, doctor. Because when you come for antenatal, your health provider should take you through a couple of things that you need to do. Some of them are routine, that you must do them, whether you have a problem or not. And commonly, we take you through a couple of tests.
Some of these tests, you need to do the hemoglobin estimation.
The blood level.
That's from the amount of blood level you have.
Yes.
We need to do your blood group.
Yes, because your blood is very important, especially for...
Might need a transfusion. You have heard of that story whereby the hemoglobin, the blood group was done in one hospital, and then the time of transfusion, they had the wrong blood group, so they never cross-matched again. They transfused that blood. The case ended up with a maternal death, and I think it's still running in court. Yeah, so it's very important to know your blood group.
Right from the beginning of pregnancy, so that at the point where if it's an emergency, then we know what blood to transfuse.
True. There are common infections, very common, prevalent in Uganda, and some of them are even on the high, hepatitis, especially B. HIV has been with us for a long time. Syphilis has been with us for a long time. So these are infections that people carry and can easily be transmitted to the baby.
So we do those tests during
very prudent care to know them.
Ensure that yes, they can be managed to prevent the transmission to the baby.
Exactly.
And of course, also during the antenatal care, we take a detailed history to know where you're coming from, to understand your medical conditions, if you had any medical conditions, if your age, and all those details to help us assess and plan for you.
We often also check people for diabetes, especially in the second half of the pregnancy. We commonly check their urine because that is a common occurrence in pregnant mothers.
So if I may, because most women actually wonder why we check for blood sugar and diabetes, because they say, I've never been diabetic, we have no family history of diabetes.
Pregnancy itself exposes people, puts them at risk of developing diabetes. Pregnancy
gestational diabetes mellitus.
Yes, a sole condition.
And that we call gestational diabetes.
Exactly.
So it comes when you're pregnant, and you didn't have it before and after your pregnancy.
Yeah, exactly. And then the urine, commonly infections. As pregnancy itself, it will predispose you. Mothers are going to tell you, I went to a toilet in Chikubo, maybe that's where I picked the infection. I have this pain, I go to the toilet more often.
You always ask them, explain exactly
what you're feeling.
Otherwise, mothers say, I think I picked an infection.
And the mix-up
but pregnancy, I think what people need to know is that pregnancy in itself lowers your immunity. And then you are able to you end up picking up infections faster than other people. And that's what you're talking about, Dr. JAFHAR, of the urinary infections, the urinary tract infections, themselves can cause a miscarriage. An untreated urinary tract infection can cause a miscarriage.
The mix-up, what I commonly say is the mix-up between a urinary tract infection and a vaginal infection. When someone has a vaginal discharge, yeah, they are going to commonly call it a UTI. I have a UTI, I have a UTI. So there's a
and even some end up with the self-medication.
Exactly, we need to keep, you take an antibiotic for maybe a normal vaginal discharge that someone is not aware of.
But I think people will kill us if we do not talk about scans, because in Uganda, every pregnant woman does scans like as often as they eat food.
Scans are very crucial, very, very important, and we encourage mothers to take scans. But routinely we advise a maximum of 3. Someone can do more if there are various indications to do scans, but we usually advise 3. You need 1 in the because the pregnancy, categorically, we split it into 3 phases, what we call trimesters. Yes, every 3 months, the first 3 months, middle 3 months, and the last 3 months. So at least you should do a scan in each of those trimesters. But the first scan is very, very important.
And of course, it's very important for those ones who have had problems with their periods, because we know that there are some mothers who have issues with their periods.
The ones who come when they don't know that they are pregnant.
And those ones who have been on family planning, because we know some family planning methods make you not to have your menstruation. So those ones need those early scans. And of course, anyone who comes with first contact.
Yeah, because you need to estimate at least how big your pregnancy is. Yes, you've had so many issues. Someone doesn't even, okay, my sisters forbid, but some people don't know who the father of the pregnancy is. They are going to use the scan to help them. I think I was with Tom the other day. Then if this scan tells me...
I thought the scan will show the baby's face looking
no, if the scan is telling me my baby is 2 months, then I can work backwards. Yeah, sure. We are not encouraging that, but scans will tell you.
The early scans will
estimate the closer to a scan that you will do later in the pregnancy.
And very good point, because women come even at 30 weeks, at 6, 7, 8 months, and they're still saying, now you see the scan dates have changed.
Yes.
And they're using the dates at
very
8 months. Very
puzzling question. They have 5 scans. Doctor, each scan I do is giving me different dates. That is expected. The dates might change.
But one thing I think that women need to know is the fact that the most important date for us is the date of the last normal menstrual.
The first day of the last menstrual period.
Exactly.
That gives us a very good estimation of when you will deliver compared to the scans that we take.
But even the early scans we do, they solve that puzzle.
Yes.
When for example, some mothers will have what we call prolonged pregnancies, which go past the time you expect to deliver. And you want to use a scan to know, should I intervene or not? So the confusion comes when you don't have any. The patient is before you, no scan, no nothing.
And they are in late pregnancy.
Yeah, we would encourage, going forward, we really encourage every woman in their reproductive age to at least keep track of your periods. There are so many applications.
Yes, now the phones have given us apps that you can just...
For so many reasons. It can even be used as a family planning tool. If you understand it well. So keeping track of your period is very important. Apart from knowing the age, you need to know whether the pregnancy you're carrying is actually alive.
Or normal. Because some you have a baby with no head, you have a baby with no legs, you want to know.
The first few months, you need to know whether you're carrying more than one baby.
Yes.
Or the number. 2. You've had cases where pregnancies go into the tubes. You need to know where it's in the right place. So the first scan is going to help you.
It's crucial to...
Exactly. It's going to see all those things. So before you make 3 months, we encourage you to do that very crucial scan.
And then we have the second scan, which is in the second trimester, ideally.
Yeah, ideally between, we usually count in terms of weeks, 20 to 24 weeks, roughly 5 to 6 months.
Anatomical assessment to assess whether the baby is fully developed without any other complications,
Exactly.
abnormalities, I would say. It's a very important scan.
The most important aspect, medical aspect
That
of
we are
that
looking
scan,
for, yeah.
as we are trying to see if your baby is anatomically developed. Do we have all the limbs present? Do we have a heart there on the right side, on the
side.
normal side? Do we have
kidneys,
the kidneys,
the liver?
Do we
Of
have
course, we
the
pick out
brain?
those abnormalities that are not compatible with life. There's some abnormalities you think they are compatible with life. Of course, with difficulty after delivery. Extra digit.
Like an extra finger.
Some things.
An extra finger.
But of course, there's some gross abnormalities that you see that even if the baby is delivered,
won't make it, or even the pregnancy will not make it to
the time of delivery.
And then one other last scan that we normally do at the end of a pregnancy.
That one has caused problems with the cords around the neck. Cord around the neck. Doctor, will I be able to push?
And there have become indications of cesarean sections and cesarean sections.
And that's the reason they're blaming us, the gynaecologists, that we've made lots of money because of the cords around the neck. No, I don't think it's true.
In recent practice, actually, it's not even advised to report about the cord. Unless there are different versions of complication of the cord. If it's making a knot somewhere.
Yes, if it has, it's very tight around the neck.
If the mother comes with a complaint, for example, my baby is not moving, kicking the way I'm expecting, then we find a cord which is tight, then you can act on it. But the baby is kicking properly and everything is fine. Then, and you know, people who make these alarms, are the sonographers
who do
the actual, they're the ones say, you go back to your doctor.
But if you remember,
it's not good. But of course, we are here.
But if you remember how many women actually deliver normally with a cord around the neck, and the training is that once the head is out, put your hand around the neck because they are, and pick the cord. We expect it. In fact, we get surprised.
So it's not going forward. It's not a routine indication for other operations. Exactly.
Yes.
You have to tie up so many things before you offer.
In a country like Uganda, where we have malaria throughout the year and at high levels everywhere in the country, every mother must be given malaria tablets to prevent malaria, because malaria
who are allergic to the drugs we use.
Because once malaria crosses the placenta to the baby, and once it has crossed over, that is a very dangerous situation.
Okay, it does not entirely stop you from getting malaria. If you continue exposing yourself to the mosquitoes, the malaria will
You lower the risk at least when
Exactly. You lower the risk and you lower the chances of having the complicated form of malaria.
And of course, the issue of folic acid. You need to take folic acid. Ideally, it should be taken before even you conceive.
To prevent
the perinatal...
we are preventing, because now we see many
problem with the
spinal
spine,
cord
which are called the neural tube defects.
Brain,
so you need to take, but of course now people are taking these, what are they called?
Pregnant
care. There's a pregnant care extra, there's pregnant care with omega. So
the more money you have, the more.
Yeah, each one has this different cost. But the most important thing here is folic acid.
Folic acid.
And maybe
very
the iron.
Cheap, very cheap and free in government hospitals and highly accessible everywhere. Dr. JAFHAR and Dr. Billy will be back to tell us about these high-risk pregnancies that we are finding a lot in this country and in our settings. So, see you soon.
You are watching the Doctalk Show.
Getting a birth certificate is as easy as 1, 2, 3. 1. Get a birth notification record stamped by a medical officer from a medical facility where the baby was born, or from a sub-county chief if the birth occurred in the community. 2. Go to the NERA offices in your area and present the notification record, a copy of the parents or guardian's national ID, and a bank payment slip of 5,000 shillings for citizens and $40 for non-citizens. 3. Apply by filing NERA Form 3 from NERA offices or download it from the NERA website www.nera.go.ug. A birth certificate will then be issued to you. Birth certificates to refugees born in Uganda are free of charge. This message is brought to you by NERA.
And now, in the doctor's room.
Right here we have a 22-week pregnancy, which is about 5.5 months, in a first-time mother, who we call a primary gravida, normal pregnancy. So this is a second trimester, and she's just in time for her to have an ultrasound scan for us to detect any abnormalities in the baby or to ensure that her pregnancy is going on well.
Our aim right now is to look at the morphology of the baby. We scan the baby right from the head. As you can see, that round shape is the shape of the head. The picture cut across. We take the measurements of the baby's head. If there are any problems with the brain at this stage, we can see them. If there's any water in the brain, what we call hydrocephalus, we are able to see it. Looks like it's all well for this baby. So we go to the chest, we look for the heart.
Amplify that heartbeat and get excited.
Some hearts develop on the right side.
Dextrocardia, those abnormalities, right?
You can see the heartbeat there.
So the heart is actually very fine and beating.
And amplified, you can
The
hear.
sound.
Oh, that is good.
So the good thing with the scan is that you can actually hear the baby's heartbeat and tell if it's regular or irregular, and if the heart is actually beating, because if it's not beating, then we have a dead baby. But right here we have a normal heartbeat and very regular.
The rhythm is okay. That could give you a hint on whether the heart is normal or not, if just from the way the heart is beating.
Yes, and of course most mothers will, at this point, most couples want to know the sex of their baby. Like this
In
particular
between
mother.
our legs, we have this and that. The sex organ should be found there,
We have one baby.
Pink,
in-
blue.
which looks like a girl.
Pink.
And in this case, we have pink.
Congratulations.
Congratulations upon the coming baby girl. Yeah, so we basically have a normal baby right here.
You are watching the Doctalk Show.
In our real life story today, we bring you Salim Semakula and his bambino bubbly 4-month-old son, Samuel. Unfortunately, Samuel was born with a huge external swelling at the back of his head that, according to doctor's diagnosis, was a result of delayed antenatal care.
Amanya gange nze nsima Betty mbera mukono nze n'omwami wange tulina omwana omu naye naafuna olubuto embeera teyali nnungi omusajja n'agenda safari n'agenda kukola ne bitamubeerera bulungi sente n'atazifuna bulungi n'embeera awo nga siina sente zintwala mu ddwaliro mu antenatal we yafunako akasente katono olubuto gwali mu myezi 6 we natandika okukola antenatal we natuuka mu ddwaliro abasawo bambuuza lwaki Nazareeti naye naali sisobola okubanyonnyola nti saayina ssente basooka okumpa obuweeke bwali bunyuufu naye obuweeke obwo bangamba mbeere ng'amirako kamu buli lunaku nembumirako mpolampola ne bugwako naye olubuto ne lubeera nga lugweza emyezi yakuzaalibwa nagenda mu ddwaliro mukono bwe naatuuka mukono naali mu mbeera mbi nentuuka mukono abasawo bwe bandaba kubanga naali nina olukindo bwe bandaba nga nina olukindo tebasobola okunyamba ne bangoba mu ddwaliro ne bansindika na Mirembe naye bwe naatuuke na Mirembe nayo ne bangobayo ne bagamba tetumusobola ne bakubira Dr. Beera Mukono International ne bamukubira essimu n'ajja nankima bwe naamala okutuuka Mukono International Dr. n'ajja nankeberamu n'angamba agenda kunongoosa baamala okugyamu omwana ne bamundeeta ne bagamba omwana wo wuuno naye aliko akantu ne mbabuuza akantu ki n'angamba kazimba naye katono tofaayo togwamu mu maanyi n'angamba bwe nva mu ddwaliro nga mmaze okuwona ngendeko mu ddwaliro bamulongoose.
Folic acid is another big effort that we have campaigns going on. Every mother, every woman that comes to the hospital that is of childbearing age would receive folic acid free from cure. And that's a very important, there has been studies that link folic acid deficiency to some of these conditions. Hydrocephalus, we still have not necessarily found that link that some of the other ones like spina bifida and other neurological issues. Folic acid is very important, and then prenatal vitamins. The point being, you need to do both. You need to be ready to take your child to a hospital, and you also need to take care of yourself even before you get pregnant. So when you know you're thinking about having a child, very important to take prenatal vitamins and to start taking folic acid even before you start to try to get pregnant.
I remember the lockdown, when the streets were empty and our lives disrupted, when businesses closed and our livelihoods hung in the balance. Hospitals were full. We lost loved ones, jobs, and hope. Our children couldn't study anymore. We cannot let this happen again. We should not go back. Get fully vaccinated against COVID-19 and join the millions of Ugandans who are already vaccinated.
The Doctalk Show.
Dr. Billy talked about 80%, 85% of the pregnancies will go through normally and smoothly. But we have that 15% that we are majorly trying to help in the antenatal care clinic.
Basically emphasizing and putting a lot more effort. And you find that we've talked about the 4 routine visits, but you find that in this class of people that we would regard as high-risk pregnancies, they might need to visit the hospital a little more often than
Of course, don't forget that every pregnancy is at risk.
Yes.
But this is a high risk.
Yeah.
Meaning every pregnancy is susceptible to bleeding, which can lead to problem, and susceptible to high blood pressure.
You can lose the pregnancy as a miscarriage. We have those who are more vulnerable than other pregnant mothers to get complications. For example, we have women who are more than 35 years. Woman who gets her first pregnancy after the age of 30.
That is a very big issue we have to be very careful. I mean, someone comes to you and you tell her, your pregnancy is high risk because you're 35. Women, our wives, our mothers, our sisters, we have to be very careful. They are usually offended.
Unfortunately, I know, and of course...
You don't want us to study, you don't want us to go to school and finish PhD and then get pregnant.
And even our midwives label them elderly
elderly first-time mothers.
I would be very offended if at 35 I'm called elderly.
Training, that is, they were just re-emphasizing the high risk by putting that word elder. A woman is very fertile from 18 years to maybe by 35. And after 35 years, some of your fertility is going down. So meaning if you get problems, start getting problems at 35, you might struggle even to get another pregnancy.
We are also thinking that as anyone, even not the pregnant mothers, if anyone grows older, they are susceptible to these other complications of life.
High blood pressure, diabetes.
So if you add another risk factor of pregnancy, blood clots.
That the pregnancy itself lowers your immunity. And the older you grow, the immunity is already low. So generally, let's try
even bone changes, they don't only occur in other forms of bones, but also in the pelvic bones. So their ability to push these babies. Yes.
Because of several factors in our country now, we are having high numbers of cesarean sections. So would you consider me, a woman with a previous cesarean section scar, as a high risk?
Yes, and that increases with the order of scars of previous cesarean.
More than 2 and above becomes even more risky.
The World Health Organization recommends, especially in our law settings, that we can try, someone who has had one cesarean section, we can try them on labor. If the reason for their previous operation is non-recurrent.
If my reason for getting the previous cesarean section is not like me having a small pelvis, I can be able to push my baby.
If it's not something that I'm sure will happen the second time, then you can try them and usually and almost, rather always, this person has to deliver in a hospital?
Oh yes, they have to, because a scar could rupture.
Is a rupture, yes.
So you must be under
both.
You must be under the monitoring, close monitoring of a doctor.
Even in those low research settings where we have majority of our people, we encourage that midwives should refer these mothers to doctors at least at about 28 weeks, that is 7 months. Then they should hand over this mother to a doctor to make a birth plan, to make a proper assessment and give them the right advice on how to deliver.
The way my old professor used to tell me that there's no doctor who has been taken to court for doing a cesarean section. But there are doctors in the courts of law for failure to do a cesarean section.
Yes, at the right time.
And of course, there are these mothers who have had problems before, like diabetes.
Oh yes, these comorbidities. You have high blood pressure, you have sickle cell, you have all these diseases that you had before the pregnancy. All those are also categorized into high-risk mothers. A mother who is diabetic, a woman who has high blood pressure, sickle cell disease.
Because each of those categories you're talking about, you're looking at a diabetic mother, so chances are high that, because what we usually fear about, one, the complication of diabetes is themselves on the mother, and then the baby. You're likely to have a big baby. This baby might be difficult to push.
And most chances you get a cesarean section.
Yes, and you might find that this is a mother who might even have to deliver a little earlier before term because you don't want the baby to become very big.
So that's why
high blood pressure itself, even when you have essential high blood pressure, rather you had your blood pressure before you conceived, your risks, your chances of having pressure associated with pregnancy are higher. So you need to be, of course, and then the complications of high blood pressure on the baby, like a slow growth rate of the baby, like premature delivery, like
and of course even high blood pressure has been listed among the causes of maternal mortality.
Of women dying with pregnancies. That's why for any woman who has high blood pressure, she's a special case. She needs to come very early to the antenatal care clinic as soon as she realizes she's pregnant.
Preferably should be reviewed by a specialist.
Oh yes, the C-class, we need to really...
Yes.
And you know, it's very common. Cycles are very common among the central Uganda, and that's where the Baganda and Wasoga, unlike other places, the north. And
in modern medicine, somehow you could determine whether your baby you're carrying is a sickler or not. But then that goes into
that will lead us into complications
whether you want
and of
to terminate the pregnancy or not.
And you know about abortions, safe abortions in pregnancy.
Medical reasons, you can determine whether your baby you're carrying in your womb as early as 3 months actually has sickle cell or not. Then we leave to you the decision.
And that brings me to the discussion of, we have antenatal classes. What do we give these women? We have birth plans. We have many people not making birth plans. You reach that end, you have to give birth and you have no birth plan.
Most of the information that people would need to know within the antenatal classes is discussed between the patient and their doctor. But we encourage that maybe small groups are made, because when you come to my consultation room, I'm seeing you as a person. But we encourage small groups to have classes.
Groups of pregnant mothers.
Sharing experiences. Because there are things that we call minor disorders of pregnancy that most people will have. A little bit of backache, a little bit of heaviness.
Feeling like the pelvis is opening up.
Early pregnancy, I'm vomiting, I have nausea, I cannot eat. Then somewhere along the way, you want to eat everything.
So like a support group of pregnant mothers.
Once you share these experiences, you know you're not alone. So within those groups, we support mothers, what we call the antenatal classes. Can be done by a midwife alone, can be done by a midwife and a doctor.
And we tell them about nutrition, what you should eat during pregnancy to increase your blood levels, to give balanced diet.
Doctor, what will I eat, what won't I eat?
Especially in this, you know, right now every one of us is trying to lose weight. So you still find a pregnant woman trying to diet.
I was 46 kilograms, doctor, wow, I'm 55.
And yes, and she wants to stay at 55. She's 6 months, but at 9 months she still wants to be.
Even want to cut the weight.
Well, most of them also ask if they should go to the gym, if they should go for yoga.
Exercises are absolutely okay. We just don't want you to do extraneous exercise in the first couple.
But the sauna is no go, I guess.
Yeah, areas that have very high
Very high
temperatures,
or very low temperatures.
excessive temperatures are not good for our young.
What about us, for us now, for you, Dr. JAFHAR, for us, we go to the Catholic churches. At least drinking a beer or two is not a problem. So a mother always put to task, even one doctor, is it going to be a problem?
It's a glass of wine.
It also brings us back to our faith. Even our faith would comfortably say drinking is not bad, but it was difficult to avoid drinking excessively. That's why it was concluded that you shouldn't drink, because you cannot. It's not easy for you to control yourself and say, okay, let me take one. One will lead to a second, and second will lead to ultimately. But alcohol itself, we discourage people, especially pregnant mothers, from
It's
taking.
just 9 months.
Yes,
You can
9 months.
avoid.
Wine has a lower risk than this other.
Beer and whiskey.
Yeah, so
just need alcohol? No.
I don't know
I
if I
don't
should say take wine.
You know, alcohol right now is not our biggest problem, especially in Kampala. Shisha is our problem.
And even smoking. Cigarettes
smoking, marijuana.
All those, now those are no-go areas.
Nicotine containing drugs are not are not safe for our babies. And needless to say, we often have lots of other infections that we get during pregnancies. And we have a tendency of medicating ourselves. There are lots of medicines that are not safe.
Advisable in pregnancy.
Yes, are not safe with our babies. So before you choose on taking any medicine,
you have to visit your,
visit
your doctor.
Yes, there's this trend now, my doctor, my doctor. Okay, send him a WhatsApp, give him a call.
But generally, I want to believe that our mothers and our girls out there have now all understood what antenatal care is all about. It is to make your pregnancy experience memorable and fulfilling, so that by the end of your pregnancy, you can look forward to a healthy baby, a healthy mother, and a healthy father, because that is what I see these days in essence.
And a successful antenatal delivery will end into a successful delivery. Antenatal care will end into a successful delivery, a healthy baby, a healthy mother, and 6 weeks after
and a healthy
delivery.
father.
And a healthy father.
Otherwise,
yes. I've seen posts on Facebook, mother, baby, and father all stable.
All stable.
And dog at home.
Hilarious.
His Excellency having a meeting with the Large Retailers and Wholesalers Association of the United States market, who source food and other products in the world and to the U.S. consumers. Uganda's economy has been growing at a steady rate of 6% for the last 30 years. His Excellency affirms that we supply the regional markets of Africa, the